Testing for joint line tenderness is often associated with meniscus injuries. The test helps identify pain and tenderness along the joint line of the knee. To perform the test, the examiner palpates the joint line of the knee, looking for localized tenderness or pain. Treatment depends on the underlying cause, but rest, physical therapy, and sometimes surgical intervention may be recommended for meniscal injuries. This test is used to assess patellar instability and the potential for dislocation. To perform the test, the examiner attempts to displace the patella laterally while the patient is lying down. A positive test result occurs if the patient shows apprehension or resists patellar displacement. Treatment may involve physical therapy to strengthen the muscles around the knee and stabilize the patella. In severe cases, surgical intervention may be considered. The bulge test is used to detect small effusions, fluid accumulations, in the knee joint. To perform the test, the examiner strokes upward on the medial side of the knee to displace fluid, then taps the lateral side of the knee to observe for a bulge of fluid. Treatment depends on the cause of the effusion but may include addressing underlying conditions and managing inflammation. The Ballotement test is also used to detect effusions in the knee joint. To perform the test, the examiner pushes the patella sharply against the femur, looking for fluid movement or ballottement in the joint. Treatment, similar to the bulge test, depends on the underlying cause of the effusion. This test assesses anterior cruciate ligament (ACL) integrity. The examiner stabilizes the lower leg and attempts to draw the tibia forward relative to the femur. Increased anterior translation may indicate an ACL injury. Treatment may involve conservative measures or surgical reconstruction depending on the severity of the ACL injury.